In the last episode of Spider-Man... In this episode of Spider-Man...
Here's Spider-Man, let me just beam this presentation into your mind.
So apparently this isn't the right name, as I didn't put the right ending on it. Actually, this is the right ending, and it's a subset of Treponema, Treponema pallidum. Treponema is a genus of spiral bacteria. It's also very close to being a clone of Hansen's disease or leprosy, and I'll talk about that in the next slide. A bit of history. The popular name this guy has is Yaws, and I'll just be referring to this guy as Yaws. The Atlantic trade spread a lot of illnesses, and the one that hung around but kinda unnoticed is yaws, most likely because the symptoms in the second stage are very close to leprosy. As antibiotics improved, the number of people with yaws dropped significantly, and a good reason for that is that you can treat yaws in the second stage, unlike leprosy. There are 3 stages to yaws. In the first stage, scarring will occur along the arms, face, and ankles, though usually these signs will be shown where the patient has been scratched or damaged. As this bacteria will try to eat the underlayers of the skin, damaging nerves and blood vessels, the body will cause a mass swelling as the immune system will try to fight it. Both stages of yaws, 1 and 2, will occur around 2 months or 3 months after receiving the bacteria. In stage 2, when the swelling starts, the skin becomes very weak, which can leave some patients with open wounds, and the cartilage and connective tissue will also get involved. Stage 3 happens after the entire body has been torn up, and it takes about 4 to 5 years for the entire body to get eroded, and anyone that survives stage 3, they usually look like zombies, but they develop bone spurs in the joints and areas where the cartilage is gone. So yaws is a gram-negative bacteria which provides the possibility of gram-negative resistances, but so far with Treponema as a whole, that doesn't seem to be the case. The most common treatment is a muscular injection with the antibiotic benzyl penicillin, which is an antibiotic used in broad variety of antibiotic injections.
Virulence factors.
Treponema pertenue uses exotoxins to break down cells. They can live on the surface of the skin. They can cause a person to develop open wounds and put stress on the body. The body isn't really able to fight off this bacteria as it locates itself in the skin in the early stages where neutrophils cannot reach, and in later stages where there's too many areas full of Treponema. Having clean and healthy skin helps in the treatment of Treponema pertenue. Spider-Man.